who would like to share their, uh, you know, opinions or thoughts about the pictures?
I think it has more to do with mindfulness, where you don't see the problem as a defining feature. It's just a part of what you're going through, and it's better to be in the present instead of focusing on that problem.
Right, mindfulness. Yes, mindfulness is about being in the present moment, being in the here and now. And definitely, a lot of techniques do focus on bringing the client back into the present moment. So, yeah, thank you for sharing that. Um, all right, so let's get started with ACT. So ACT is pronounced as the word act and not as ACT, something which is, majorly emphasized in a lot of books. But it is a mindfulness-based, values-directed behavior therapy. And there's an acronym for ACT, which says that A stands for accept your reactions and be present. C stands for choose a value direction, and T stands for take action. So it's a behavior therapy, which, and behavior therapy is a lot about, being action oriented, dealing with thoughts in such a way that we can take effective action when it comes to dealing with challenges or mental health concerns. But what is really unique to acceptance and commitment therapy is that apart from just focusing on taking effective action, it also focuses on being mindful, being accepting, which means being non-judgmental, which means being kind and compassionate, as well as being true to yourself. So when we talk about choose a valued direction, value direction is something which is unique to every individual. My values might be different from someone else's values, and same goes for all of you. So we focus a lot on what are the values of an individual, and they become the motivating factors to take action and to bring outcome out of therapy. So it is a third wave behavioral therapy, and it was developed by the clinical psychologist and professor from University of Nevada. His name is Stephen Hayes. And further, the philosophy of ACT is based on relational frame theory, which is also developed by Stephen Hayes. And again, this is a very complex theory. Like it can take about, I think, 1 or 2 hours to just like talk about this theory in detail. So we are just going to, very basically understand that it's a theory on human language, which is based on relating. So what that means is that all of us, how we perceive our world, how we perceive information around us is based on how we relate to that information, and relating happens through human language. So there is this concept in ACT which says that a lot of our psychological and emotional suffering can be based on human language itself, because it's based on how we are perceiving the information around us, how we are labeling it in our minds, what do the thoughts sound like. So that's how it draws from relational frame theory. And the next concept is functional contextualism. So it's a long word, but we'll try to understand it doing an exercise. So basically, functional contextualism is about how behavior of an individual can be different in different contexts, and it focuses on what the function or the purpose of a behavior is in a given situation. So now, all of you, I would want you all to imagine that there are 5 different people in 5 different situations. And so these different people, they're waving their hand. Now we have to see what could be 5 functions of waving a hand, or like what could be 5 different reasons of waving, why would a person wave their hand. So either, one of you can come up with all 5, or, all of you can come up with like one different reason or why a person would wave their hand.
So I'm trying. So one person could say hi, another person could be saying bye,
Yeah.
another person could be signaling that they are there, like someone is there to meet them and I am here, like
Yeah.
that.
Yeah.
So yeah, those are the three I could come up with.
Yeah. Yeah, that's good.
One could be to grab somebody's attention when you're in a public setting.
Yeah. Yes, that's right. Anyone?
Someone can wave for asking for help.
Yeah. Yes, absolutely. Okay, so there we have 5 different functions of the same behavior: saying hi, saying bye, trying to get someone's attention, uh, asking for help, or just making their presence felt. So the behavior is the same, which is waving hand, but the function is different in different situation. And that's where, again, the theory of functional contextualism holds relevance in ACT, because we focus on what um, the particular behavior of an individual is in a given situation. And there also comes this whole idea of workability, where we don't judge a particular behavior as being right or wrong, but we see what purpose is it solving, how effective is it in helping an individual, function in their life. So if we talk about, for example, drinking, and if there is an individual who is drinking maybe like 1 bottle of alcohol every day, and what that 1 bottle of alcohol, or what that action or behavior of drinking is doing, is that it is maybe leading to fights with family members, or inability to focus at work, or violence at home. So in that case, the function of the behavior of drinking becomes problematic, and hence we need to work towards changing it. But if, say for example, a person is having 1 glass of wine every day, but that 1 glass of wine is not really causing any kind of harm or disrupting their environment, that 1 glass of wine is not really making their performance at work, it's not affecting their performance, it's just a part of their lifestyle. So in that case, we will probably not touch the whole action or behavior of drinking till the time it is serving a function which is helping an individual be effective. And there this idea of workability comes into picture. Now, the third concept is mindfulness, the concept of being in the present moment, allowing your feelings just as they are, and also bringing your conscious sensory, awareness to the event, to the experience that you have right now. So, again, a small exercise. Maybe I want you all to just close your eyes for a minute. Okay, keep your eyes closed. And in this moment, we are slowly and gradually going to bring our attention to our body. Okay, now, in this moment, as you are slowly and gradually bringing your attention to your body, there might be a lot of different kind of factors affecting you, like your thoughts, maybe the sounds around you, maybe some feelings, but we are all just going to let them be as they are. And we are slowly and gradually going to just focus on our body. Okay. Now, as we are focusing on our body, I want you all to just notice any sensation that stands out to you, anything that is distressing, or anything that can make you feel uncomfortable, or even if it's not an uncomfortable feeling or sensation, it can just be a pleasant sensation. So any sensation that stands out to you. Now, as you are focusing on that sensation, just notice how it is without attaching any meaning. We're just going to notice the sensation. And maybe try and describe it to yourself. You can do that mentally. Be curious about it as you describe. Be compassionate as you describe the sensation to yourself. Okay. Now, slowly and gradually, whenever you are ready, you all can open your eyes. Okay. Anyone wants to share anything that they felt or experienced? Or if they didn't experience anything at all, that would be welcome too. Okay.
I experienced like I focused on my breathing, like I could like that was a sensation that made me feel very pleasant.
Okay.
Other than that, everything was just calm.
Okay. All right. Thank you for sharing that.
May I?
Okay.
Yeah, sure. Go on. I believe there was someone who's going to speak.
May I start?
Yeah, absolutely.
So, ma'am, I did not have any like specific sensation that I could focus on, but the entire exercise made me feel very calm.
Okay. All right. That's good to hear.
When I initially started, focusing on the sensations, I noticed my heartbeat. It was kind of fluttering, but the more I was breathing slowly and the more I focused on my heartbeat, it kind of calmed down. And by the end of it, I didn't, nothing really stood out. It was all calm. So it was a good
Right.
experience.
Oh, I'm so glad to hear that. All right. So through this exercise, what we were just trying to do was just bring our attention to a particular sensation. And this can be done with anything. So there is this technique in ACT which is called Notice X. And X can be anything. It can be notice a sensation, it can be a feeling, it can be a thought. The idea is that all that we need to do is just bring our attention, and maybe like while bringing our attention, we can also do a little bit of deep breathing if that helps to center ourselves. And we have to be non-judgmental. So judgments are, you know, rights and wrongs, and judgments are about the what ifs, the shoulds, the have nots. But just being curious is about, okay, what is this? Where is this coming from? And let me be kind towards it. Let me just allow it, whatever it is. So that's what mindfulness is about. And it can be applied to anything. Now, going further into the number of sessions of ACT, acceptance and commitment therapy, well, again, it's a very flexible therapy, which is what I love about it the most, that there are a lot of protocols when you start researching, and there are long-term therapies as well, long-term ACT, therapies where there are weeks, sessions are divided into weeks, and then there are brief and very brief therapy sessions also. But most of the books or researchers would say that if you are starting with ACT, you can just go ahead start with 6 sessions and see the outcome of those 6 sessions. What are they like? Now, what are the goals of acceptance and commitment therapy? One of the most important goal is increasing psychological flexibility, and we are going to study about psychological flexibility in greater detail. But in other words, it's basically being resilient in the face of any kind of challenge. It's any human's ability to, face distressing situations, emotions, while also being able to experience their, emotions, their thoughts, and being able to overcome them. So based on that, the other goal of ACT is to focus on the interaction with the internal experience rather than changing them. So a lot of other behavior therapies would focus on changing thoughts and thought patterns, like cognitive restructuring or reframing, or thought challenge would be focused on changing a particular thought, or giving an alternative thought. But ACT doesn't do any of it. It doesn't categorize thoughts as rational or irrational. The goal of ACT is to just focus on how am I interacting with my thought. What is this thought making me feel, and what am I doing when I'm experiencing this thought. And the other goal is a healthy relationship with internal experiences. So a lot of times we would notice that a lot of clients who are experiencing mental health concerns would also have shame and guilt about what they are going through, which makes their pain and suffering increase, and it makes them feel stuck. So ACT focuses on having a healthy relationship, which is a compassionate, a kind relationship, and again, like an accepting relationship with our internal experiences. So with all of this, we try to create a rich and meaningful life while accepting that pain is inevitable. Suffering is inevitable. There are a lot of situations in any human's life which are going to be out of our control. We are going to experience loss. We are going to experience loss of people around us, and then there's death anxiety, which comes right, in the face of all of us. And it's hard to even understand something, as like to just understand loss is hard. It makes us feel out of control. So there's a lot of pain associated with inevitable situations, but how can we still continue to lead a meaningful life, a purposeful life along with that pain, is what the goal of acceptance and commitment therapy is. And not to forget, it's a behavior therapy. So the outcome and the effective action part of it is very much there, which is guided by our values, as we had discussed earlier. Now, there's also this model of psychopathology. So there's this concept of psychological rigidity, which is the exact opposite of psychological flexibility. And again, this is something that can be common to a lot of mental health concerns. It can be common to people who are experiencing anxiety or depressive episode, or people who are experiencing loss or trauma. So what is psychological rigidity is what we are going to study right now. And for that, we will first understand the concept of fusion. And for that, what I want all of you to do is that your hands, imagine that these hands are your thoughts, all right? And I want you all to think about any kind of thoughts that you've had maybe in the past 1 or 2 weeks, which have been a little worrisome. So not extremely distressing thoughts, but just like tiny bit of worry that you had, maybe an important exam, or maybe a fight with a loved one, or just a bad experience while sorry. Okay. Okay, so imagine that your hands are these worrisome thoughts that you have, and wherever you are seated right now, all of your surroundings are, significant experiences that are going to happen. So I'll just give an example, that maybe a significant experience for me was this workshop. And maybe the thought that I was having was that, oh my God, I have a lot to do, and I have to prepare for this workshop as well. So this was a worrisome thought, and the significant event was the workshop. So now, after imagining this, what I want you to do is place your hands like this in front of your face, and slowly and gradually bring it close towards your face, like that, slowly and gradually. Now, bring your hands close towards your face, covering your eyes. Now, I want you all to try to see your surroundings through the gap of these fingers, through the gap of your hand. Is it difficult to see your surroundings like that? Okay, we are not done there. Now, what I want you all to do is slowly and gradually start lowering your hands. Start bringing them down. We're not going to keep them away. We're just going to bring them down till here. And you can see your hands are still there, but you can also see your surroundings. Yeah. So it's a little bit easier to see your surroundings while also see that your hands are there. Okay. So basically, this is what fusion is about. So fusion is when your thoughts cover your perception, when your worrisome thoughts, or the negative thoughts as we commonly call them, they make it hard for us to see the situations around us, or even focus on important events in our life. So when our thoughts become dominant, when in our situations, in our day-to-day life, we call that fusion. And when you started taking your hands away, you kept them at a distance, that was the process of diffusion, which we are going to study again in the upcoming slides. So diffusion is the opposite of fusion, where we focus on how can we keep the thoughts at a distance. So we don't take them away. The goal is to not take those negative or unpleasant thoughts away, but to push them at a distance. So that's what fusion is. And fusion is, again, common to a lot of psychopathological conditions. It's prevalent in depressive episode, again in anxiety disorders, in any kind of phobia, in traumatic experiences, in day-to-day stress of life as well. And apart from fusion, we also have experiential avoidance. As humans, we would try to find solutions to everything in life. For example, we have to go somewhere and my car is not working. What would be the solution to that? Would be to take public transport. I have lost my documents. What do I do? Maybe I try to reach out to authorities to find out what are the other ways of getting, the documents back. So there's always a solution that we are trying to find as humans to whatever problem we are experiencing. But sometimes those solutions are not possible. If there is a family member, for example, who might have narcissistic traits, maybe a parent who is extremely, abusive as well, or verbally or emotionally, and neglectful and focused on themselves, and just making it very difficult for me to survive in the house. In those kind of situations, in order to cope with that, what I might start doing is, maybe I can probably start drinking, or I might start using some sort of other substance to help me cope with that pain that I'm experiencing in my house. Or it can be through binge watching, binge eating, or it can be through developing a coping mechanism of perfectionism, that I want to please my parents. I want them to be happy with me, so I try to do everything perfectly. So all of these kind of coping mechanisms fall under the category of experiential avoidance, because we are not able to find solutions. We might go back to different kind of coping mechanisms, and again, going back to those coping mechanisms might not be a bad thing. For example, I had a client who was living in an abusive household, and her way of coping with it was to have like a lot of friends and like be dependent on friends. And what that was doing was that it was leading to a lot of dependence on friends and seeking validation from other sources. Now that might not necessarily be a bad thing, because um, we have to understand the context of the individual, the household, the kind of pain that she is going through. But we are also seeing that, okay, it is what it is doing is that it is leading to dependence on other people, and that might also not be healthy. So what we can try to do is we can try to help the individual draw a little bit of boundaries and understand that, okay, it's absolutely fine to find healthy friendships and support systems outside of your house, and maybe we need that. But how can we stop ourselves from depending on them? So that's where what we need to do is learn to accept our own thoughts and feelings. Because what happens is that a lot of times, like talking about this specific example, when we are going through abuse, or we are going through an environment where there's a lot of emotional neglect, it leads to a lot of painful feelings for an individual inside, which they're not able to probably cope with, because they never learned those coping mechanisms. So all of that distress becomes so hard to experience and to cope with that they find other means to help them soothe themselves. So that would fall under experiential avoidance. But through ACT, what we can do is just help them be their own soother. Just help them to soothe their own emotions and experience pain in a way that makes them feel strengthened, and helps them cope with the distress. So now moving on from fusion and experiential avoidance, there are other processes such as inflexible attention, remoteness from values, unworkable action, and fusion with self-concept. So basically fusion and experiential avoidance are some these processes, core processes that can be found in all these other processes as well. Inflexible attention is basically feeling disconnected, disengaged, and distracted. That's why we're not able to focus. We don't have sustained attention, and it's mostly because of fusion with our thoughts, or because we are not able to experience our own thoughts and feelings in a healthy way. Remoteness from values. So if we are constantly stuck with thoughts, or if we are constantly trying to avoid urges and emotions, we are a lot of our energy is just going into keeping ourselves functional. And what that does is that it puts us into survival mode. So it doesn't really, we don't really think about what is authentic to me, what is my value. I'm just thinking about what will help me survive. So fusion and experiential avoidance leads to remoteness from values as well. Unworkable action. Now, because there are no values, my action will not come from a place of maybe like achieving whatever is crucial and important to me, but my action again will come from whatever will help me survive. So again, if it is drinking that is helping me survive, I will continuously keep doing it, because that's my only way of coping that I know. Then fusion with self-concept. So now, because of these thoughts and feelings that we're having, we're also constantly, there's a part of us, and in ACT we call it the observing self. So there's a part of us that is experiencing, like a part of me is talking and explaining, but there's a part of me which is like constantly on the vigil and telling me that, okay, Akanksha, maybe don't fumble, or we have to like make sure that we do this on time. So there's my observing self is active there, right? So now what happens in fusion with self concept is that my observing self is not that active, and my thinking self, which is probably explaining to you, which is very reactive right now, my thoughts become fused with my thinking self, which means that if I am thinking that I'm not explaining this well, then what is happening is that that there's a belief or there's an idea about myself that, okay, I'm not an efficient psychologist right now, I'm not being efficient right now, or okay, I'm not doing justice to this, oh god, I will never be able to be good enough. So my idea of who I am is being derived from constantly from my negative or unpleasant thoughts. That's what fusion with self concept is about. So let me just pause here. I want to understand if there are any questions, specifically related to the ACT model of psychopathology. Okay, no questions? Okay, all right, so we'll move further. Now we come to the 6 core processes of ACT. So we are going to study the processes which are exactly opposite to what we studied right now. So we are going to talk about psychological flexibility, which is basically being able to be in contact with the present moment, being able to accept and not be in control, being able to keep your thoughts at a distance, being able to see yourself for who you are and not just for what the thoughts and feelings that you're having. And psychological flexibility is also about understanding and knowing what your values are and taking actions based on your values. So this is what it is about. And again, so basically the 2 components, acceptance and commitment, I've tried to divide the pointers here. So contact with the present moment, acceptance, diffusion, and self as context, these 4 processes would fall under acceptance, and values and committed action would fall under the concept of commitment here. All right. Okay, so going a little further into contact with the present moment. Okay, is there anyone who would like to guess what contact with present moment is about, or explain their own understanding of it?
And being mindful.
Yeah. Yes, in a way, yeah. Actually, not in a way. I think contact with the present moment is definitely, being mindful. It's about just becoming aware. It's about bringing your sensory awareness right in front of you, and making sense of what is happening without any judgment. So what we did, the exercise that we did was, when I asked you all to describe the sensation to yourself without any judgment, we were using our language, we were using our ability to make thoughts just to understand the situation the way it is, and not that, okay, if my heartbeat is increasing, am I having an anxiety attack right now? So that would be like giving meaning to it, or predicting or judging it. But if I just like focus on and make sense of the fact that, okay, my heartbeat is fast, it's increasing, and that's it. So that's what contact with the present moment is about. And acceptance is an alternative to experiential avoidance that we discussed. So it is about being non-judgmental of your thoughts, feelings, your memories, your experiences. So, okay, talking about the example of the client who was experiencing abuse in her house, there was a lot of internalized shame for not getting maybe the love from her parents that she deserved. And because of which there was a constant feeling of, I'm not enough, I'm not lovable, or also a fear of abandonment. But acceptance was about acceptance in that situation was about being non-judgmental of these feelings, that these feelings and thoughts are a part of you, they are a part of who you are, and they are a part of your experience, of your context, and that doesn't make you any less. So we were trying to do away with the meaning that she was giving to herself and just like focusing on acceptance in a non-judgmental way. Now, cognitive diffusion. So, diffusion, as we discussed previously, is basically the ability to keep your thoughts at a distance, which is extremely hard to do in our day-to-day life, because I think the nature of thoughts is such that we all get, engulfed with them at some point or the other. But diffusion is the ability to basically, you know, just look at the thought that, okay, this is what my thought is telling me. And it is actually also a technique that this is what my thought is saying, or or I'm having the thought that, I have to travel alone and I'm so scared. So, yeah, that's what diffusion is about. And self as context, the other process, we spoke about observing self. It's basically the ability to just observe your experiences, internal experiences, and know that these experiences are not the only experiences that define you. These thoughts and feelings are not the only thoughts and feelings that define you. At this point, I just want to say that, as I'm also explaining, I'm realizing that these concepts are overlapping, and which is true. Again, when you read a little bit more of research on ACT, you will understand that these concepts are kind of overlapping, and which is why you can, there is no set or rigid criteria of using them in a particular way, in a structured, in a certain structure, that you have to first use diffusion or acceptance. It's about understanding that, okay, these are the processes, and noticing them in your clients, noticing them in a setting where you are working with clients who are experiencing, stuckness with their thoughts, or with a certain situation, and then understanding that, okay, what is going on, or what could be applicable here. Okay, moving on to values and committed action. So values are basically, our unique qualities that make us who we are. That values make us different and authentic, and values basically help us lead a rich and meaningful life. Because if we exactly know that this is what I want from my life, or this is what I want my relationships should to look like, or this is what I want to do with the limited time that I have as a human on this planet, then I would be able to take more and more action based on what I want, what I stand for, what I believe in. So yeah, these two are important components in basically taking action. And now, at this point, I feel like we've discussed a lot of theory, and we will be soon moving into techniques based on the processes of the psychological flexibility that we just discussed, and application bit as well. So I was just wondering if we could, or like maybe take a small break, have a little bit of water, and we can probably come back if that's okay. Start again. Okay, so we just discussed about the 6 core processes of psychological flexibility. That was the theory, but how do we put it into practice in the sessions? This is what we're going to focus on now. So we are going to focus on some basic techniques that you can do. And in the applications bit that we'll discuss, we will focus on where and when to use which concept. So, okay, now we'll start with contact with present moment. So we just did the mindfulness exercise, which was to focus on the sensation. But apart from that, you can also do any kind of deep breathing exercise, the box breathing exercise, which is to, start with taking deep breaths for 4 seconds, inhaling for 4 seconds, and then stopping for 4 seconds, and then exhaling from mouth for 4 seconds, and then again stopping or pausing for 4 seconds. So that's the box breathing technique that can also help. Apart from that, it can be stretching. A lot of times, deep breathing doesn't work for a lot of clients. They get bored, or they're not motivated to do it. So, in that case, movement helps. Movement helps specifically with individuals who have been experiencing depressive feelings, or who have been experiencing any kind of trauma or numbness. So movement like stretching, stretching your arms, touching your toes, basic stretching exercises can also help them, come in contact with the present moment and leave their internal experiences. And apart from that, there's notice the 5 things that you can hear, see, and feel right now. So yeah, that's just the basic contact with present moment. Then we will then there's acceptance, which is in acceptance we focus on willingness, and there is this metaphor for helping individual understand what is willingness and what is tolerance. So for example, you are having a guest in your house who is a little irritating, whom you don't really like, or they're just making a little your own living in your own house difficult for you, and you just want them to go away, but they're not going to leave for the next 3 days. So what do you do in such kind of a situation? There's one that you tolerate them. So now tolerance would lead to, okay, I'm going to keep doing these things for them. I'm going to probably, whatever need that they have, I'm just trying to make their need, I'm going to try to meet their needs. I'm trying to make them feel comfortable, but I'm doing all of this with the expectation, with the hope that they'll probably go away, or with the hope that they'll probably stop annoying me, or let me just focus on my own work. So that's tolerance. And well, that can help in some situations, but tolerance in for a long time can lead to just aggravating our own distress and suffering. So willingness is the opposite of tolerance, which is to understand that, okay, they're going to be here for 3 days, they're not going anywhere, and this is how their behavior is, and I don't like that behavior. They are always, kind of pokey, they're interfering, I don't have my own space, but they are here to stay. So now that they're here, I just have to understand that I have no option but to just accept their presence, and it's okay. I'll not judge them or judge myself or judge my pain, but I will just be willing to, sort of make peace with that situation. So acceptance is different from tolerance, and a lot of times clients would come in therapy sessions, especially in the context of relationships. They would say that, oh, I have a partner, or again a parent, a family member, whose behavior is disturbing, it's annoying, but they would say that, but I'm trying to do this. For example, maybe my partner is not giving me enough time, or maybe my partner is not present for me, but I'm constantly trying to do other things to get their attention. But what that is leading to is that I am basically increasing my own suffering, because the message is also not getting across to them. And I'm just like tolerating this thing that I don't like about them. So what can be done in that situation is, basically to communicate that this is something that I don't like. And for that to happen, the individual need to first accept it with themselves that, okay, my partner is being distant, or my partner is not being present, and I need to do something about it. So that's what acceptance looks like. There is another metaphor, which is two countries at war, which is basically trying to help the client understand that, okay, imagine you are in a country whose neighbor is another country which is very volatile, or another country which is completely different in terms of their ideologies, but you just have to kind of function because they are your neighbor. So one situation can be that you are at war with that country, which will lead to a lot of loss and damage. The other situation could be that you form a truce with that country, but that might also not be very long lasting. And the third situation would be that, okay, we try to work towards genuine peace and harmony, which is what, again, acceptance would be about. That we accept their ideologies just the way they are, but we focus on, how we can function together. At this point, I also want to just mention that ACT uses a lot of metaphors, and I probably, get in touch with Ankita and share a couple of them. They can be really helpful in therapy sessions, just to introduce the concepts, also to psychoeducate clients also. Now, diffusion again. So we discussed about diffusion briefly when I said that one way of keeping your thoughts away or at a distance would be that to remind yourself that this is the thought that I'm having, or I'm having the thought that is telling me this. Other ways of diffusion are repetition of a triggering word. So example, a word which is triggering is failure, that I'm such a failure, or I'm a loser, or maybe someone says that to a person, to a client, that you're a loser, you're good for nothing. So that word, repeating that word out loud several times, failure, 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 and like continuing it for maybe like 2 minutes, 3 minutes. You can give it a try maybe after the session. You'll notice that just repeating that word would take away its meaning, and only the sound would remain. So what this does is that it reduces the distress that a person is experiencing from a particular word or from a particular thought. Other examples of diffusion are saying some thoughts, triggering thoughts in a very silly voice, or it can also be like in a funny way, or in a song, or in slow motion. So and this is also a very widely used technique in a lot of other practices or therapies as well, and it is quite effective because a lot of times some thoughts bring in painful memories and aggravate a lot of suffering for individuals. So if we just ask them that, okay, I want you to think about the funniest voice of a cartoon, or the funniest song that you've heard, and I want you to now think about that thought in that voice, or probably say it in the same way if you can, also helps to take that distress away from the thought. Now, coming to the observing self, or self as context. So now there are these 6 steps that are given, which is about again, noticing or bringing your awareness or attention to X. So X is anything, any sensation, any feeling, or any thought. And what we are trying to do is that we are basically guiding ourselves to notice that we are noticing that feeling, and that feeling can change. So I am bringing my awareness to the feeling of sadness, and I'm aware that I'm noticing it, and there is sadness, and then there is me who's observing that feeling of sadness. And I am also observing that sadness changes. So we have to do it for a couple of minutes for the feeling to also stay and change forms. And then we have to help the client understand that the you that is noticing sadness, so I'm noticing sadness, I'm not changing, but sadness is changing. So this exercise basically helps an individual understand that your thoughts, your feelings, your sensations can change, but you, who you are, the observing individual, you are constant, and how you are separate from these internal experiences as well, how they are just a part of you. Moving on to values. So again, there are a lot of worksheets also on values, which are just available out there, which can be really helpful. But values are basically, you can devote a session or like a part of a therapy session, just to understand or help an individual get in touch with understanding who they are, what do they really want. So the exercise on values basically would contain a lot of questions and a lot of worksheets also that can help an individual, get in touch with themselves. Another way of understanding a person's values would be to, help them visualize that, give them a situation where they are probably an old person, or, looking back, or they're celebrating something, they have aged and they're celebrating their years lived on this planet. And now, you look back, you see what all was important for you, what was significant for you, what stood out for you, what do you think will come up. So this will be this visualization technique will help an individual probably come out from their feelings of stuckness when they don't know. Like a lot of times clients would say, I don't know what I want, I don't know what I'm doing right now, or I don't know how I'm feeling, or I don't know how that affected me. So in those kind of situations, these visualization techniques can really help to get them started on just thinking about themselves. So now when we talk about committed action or commitment, well, this would be basically again psychoeducating the client to understand that when your values, when you're sorted with your values, when you're sorted with your goals, and you're at that stage where you're deciding to take action. For example, there's an individual who's deciding to take action on getting started with working out or getting started with exercising, because health is very important to them as a value. But now when we're going to get started, we have to educate the client that this is not a promise, this is not a prediction. Basically, what we're trying to communicate to them is that don't be harsh on yourself, because a lot of times people think that, okay, I'm now ready to take an action, but there will be a lot of obstacles, there will be a lot of challenges where they will probably get a little disconnected from their goals, and they will probably lose touch, or some unpleasant feelings might come up again, where they might again go back to square one, or not feeling motivated. So we help them understand that even though that you are, you've taken this committed action, that doesn't mean that obstacles will not stop. That doesn't mean that you're not allowed to fall. It's okay if you fall, but committed action is about getting up and getting back on track, and not letting that one moment of slip define who you are as a person. So these are some very brief techniques about the 6 core processes. And okay, sorry about that. Now we move on to applications. Yeah. Okay, so acceptance and commitment therapy, there are a lot of researchers that say that it is effective for almost anything. It can be molded, and it can be applied with any kind of therapy that you are already doing, and any kind of concern that can come up, except for maybe concerns where an individual is not able to, probably is having some deficits related to language and thinking. In that context, maybe ACT might not be very effective, but it has been shown to be effective for anxiety, depressive episode, obsessive compulsive disorder, phobia, substance use, yes, psychological adjustment to cancer, epilepsy. Well, I think psychological adjustment to so many situations, in so many situations we need to adjust. And even when there is loss, when people are moving, there's end of a relationship, there's loss of a job, there can be loss of a dream, any kind of situation where an individual requires readjustment, ACT can be used. Now, moving on to what the initial sessions of ACT will look like. The first session is going to be very similar to a lot of other sessions that you're already doing. So it would be about establishing rapport with the client. A little bit of psychoeducation about what you're going to do, or what your approach is, can also be helpful. Then informed consent is important. Taking history is very important because we focus on the context of the individual a lot. So we have to focus on certain behaviors, that maybe, for example, they are finding abnormal or dysfunctional. We have to really understand where these behaviors are coming from in order to provide effective treatment. And yeah, we have to establish behavioral goals. That is extremely important. And apart from that, in the first two sessions, you can also give some mindfulness exercises. You can also introduce the concept of mindfulness to them. That can be a good start. Okay, now after the first two sessions, what are we going to do in the upcoming sessions? So now the concerns can be different, but basically I've categorized them into what generally clients bring into therapy sessions. So if you're noticing a client who is feeling overwhelmed, or disassociated, or highly impulsive, or extremely anxious, then grounding exercises can be very helpful. So you can take a couple of sessions just to help the client learn to soothe themselves through mindfulness based exercises, through acceptance. So that can be possible. Then when clients are experiencing grief, loss, or sadness, there might be a lot of judgment in their thoughts. There might be a lot of criticism in their thoughts. There might be a lot of guilt, regret in their thoughts. And these are emotions that make a person feel less about themselves. So when we are feeling like that, we most of us would become critical of ourselves. So self-compassion, again, a component of acceptance, would really help in these situations. So self-compassion would be about understanding that it's okay to feel these thoughts, or it's okay to have these thoughts, it's okay to have these feelings. And yes, these thoughts and feelings are painful, and sometimes you don't deserve to go through them. A lot of people need to hear that as well. So cultivating self-compassion can be helpful. Now, for those individuals who are feeling stuck, feeling hopeless, hopelessness makes an individual feel less motivated, often noticed in, depressive episode, depressive feelings. In that case, beginning with values can be helpful, but I think there's one point that probably I feel on second thought that can be added is, again, mindfulness exercises, which are movement based, can also be very helpful in the initial few sessions. And then maybe bringing the focus on values, bringing the focus on what is important to them. But apart from that, I think diffusion would also help, because a lot of times people who are experiencing hopelessness would also ruminate about certain thoughts that are coming to them again and again. So in that case, we can use diffusion based techniques where we help them keep their thoughts at a distance. Now then, we have a lot of these situations where clients come and they would say that, I just want to feel good, I don't want to feel this way, I don't want to feel pain. And even though that is a valid expectation to have, and who wants to feel pain? But also it might not be a very realistic expectation to have, because when you do get hurt, you experience pain. And unfortunately, we cannot avoid that, especially emotional pain. For physical pain, we have painkillers to avoid them, but for emotional pain, we just have to probably come face to face with them at some point. So, but now you have a client who is not ready to do that. Now you have a client who would say that, I don't want to face my pain, I just don't want to do it. And yeah, there can be a lot of clients who are in that space. So in that situation, beginning with creative hopelessness. So this is a concept where we create question, okay, what have you done so far? We try to understand that okay, you've probably been trying to feel good, you're forcing yourself to feel good all the time, but how effective has it been, or what and what cost is it coming at? So when we start questioning their coping mechanisms, when we start questioning their hopelessness, slowly and gradually, there is room for acceptance that starts to come into picture. They start realizing that okay, what I'm doing, these coping mechanisms, they're not really helpful, and I'm just avoiding my pain. So when they come face to face with that, then we can bring in another concept that okay, yes, coping with pain is difficult. You don't want to feel sad, you don't want to feel this hollow emotion, but what we can do is that we can start to slowly and gradually develop techniques or develop skills that can help us cope with those emotions better. And then you can introduce the concept of mindfulness, the mindfulness based techniques. You can introduce the concept of acceptance, you can introduce the concept of self compassion, and slowly and gradually we can take them away from their resistance. um Okay, so at this point, I thought it would be maybe nice to discuss or like just talk about this particular client with whom I used ACT-based protocols, and it was very effective. Also, because the client was very willing, I had the opportunity to work with a client who was very invested in his mental health, and he was given the diagnosis of obsessive compulsive disorder almost 15 years back, and he struggled with very painful urges. And now these urges were about they were not physical in nature, they were not behavioral urges. These urges were um, more to do with daydreaming. So whenever there was any kind of distress that the client felt, there was sudden urge of escaping into his fantasy world. And now what that did was that went on for hours and hours, and just keep taking the client away from their day-to-day life. So there was a lot of distress, but through ACT, what we aimed to do was that we aimed to focus on the client's relationship with the urges. That whenever the urges start they start kicking in, what is the client doing at that time? What can they do differently at that time? And a lot of times the client would kind of uh, force himself to not get into that urge, but it would happen anyway. And then there was also a point where we realized that it is not under our control. So we just started with understanding that okay, it's okay that you are having this urge, that you feel like escaping into a fantasy world. It's absolutely okay for you to do that. So we brought in being non-judgmental, we brought in being accepting towards that behavior that was happening. And then the aim was that when you do notice, whenever there is a point in time, maybe like after 30 minutes or 1 hour, that you notice that okay, I'm stuck in this world of fantasy, or I'm daydreaming, that's the point that try to just calmly talk to yourself that okay, I was fantasizing right now, I was daydreaming right now, and it's okay. I can slowly and gradually take a step out of it. That's the time when we can practice diffusion, or with acceptance we can try to take steps away from it. So that was the first step. And from there to the client just understanding how his urges are functioning, it was a very fruitful journey, I would say. And apart from that, we also worked on his major fears, underlying fears of rejection, of experiencing pain, which was leading to perfectionism as a coping mechanism. So again, we used self-compassion based techniques and the philosophy of self-compassion to come face to face with those fears. So yes, this led to the outcome that the urge is reduced after about 8 months, and after a year the client stopped taking sessions, this therapy was terminated. And also, what was really helpful with this particular client was um, giving him the ACT module. So I had developed a module for this client specifically for the client to understand that, okay, these are the values. This is what values stand for, and this is how values can be helpful for me. So just as an example, you can always talk about the therapies in detail, the philosophy of it in detail with clients who are receptive, who are insightful, and you can always collaborate that with them. Okay, so this is a tool, the ACT matrix, which is again an essential tool maybe in the beginning of sessions, especially again when clients are feeling stuck or they are feeling directionless, they don't know where to start from. So the first step is to ask them what is important to them, introduce the concept of values, and also decide a goal that they want to move towards. So for example, the goal that an individual wants to move towards is, I want to exercise to maybe lose a certain amount of kgs, or just like to maintain a healthy lifestyle. And so that would come under the towards direction. And we will again talk about what is important to them, why is it important to them to exercise. We will try to go into the details of it, and we will try to come up with values. Then we will focus on the thoughts and feelings that show up when things get tough. So for instance, this individual wants to really work out, but what is stopping them is a very hectic lifestyle. Maybe they are working in a shift that doesn't allow them, they're working in the night shift, or maybe they don't have time, they don't have access to resources. So now we focus on when these obstacles are coming up, what are the thoughts and feelings that are coming up. So if an individual doesn't have access to resources, or they are staying up at the night, or they're just not able to function, the thoughts could be that okay, I'm not doing enough, or I will never be able to achieve this goal, I always do this. So these are thoughts and feelings that are coming up that are also affecting their behavior again, so we make a note of them. And this, as you can see, would come under away. So away because it is moving away from their goal. Step 3 would be to understand what does that individual do when these thoughts and feelings show up. So we ask them that, okay, you feel bad that you're not able to work out, you feel guilty, you feel like you're never able to achieve your goals. So what do you do in that situation? What do you do to cope with those thoughts and feelings? So then sometimes people don't know, because those behaviors are so automatic that I feel bad about myself, and suddenly I feel bad. So in order to make myself feel better, I'll just go and grab a piece of chocolate to make myself feel better. And then I'm doing that again and again without even realizing. So now this third step would help them understand what they are doing in those to deal with those thoughts and feelings, and again how that particular action is taking them away from their goal again. The fourth step would be to take committed action. So okay, you are feeling bad that you could not achieve a particular goal. So instead of picking a piece of chocolate, what else could we do? Maybe we could bring in a mindfulness based technique again. Maybe we could help them just practice non-acceptance, that is okay, it's okay, I could not achieve my goal today, I'll try again tomorrow. I should not judge myself or shame myself for not being able to achieve my goal today. So so the fourth step would be to help them again get closer towards their goal. So this matrix can really help. You can keep coming back to it. It's not just that we have to make it in the beginning of the session and not visit again. This is something that we can keep coming back to, especially when clients are losing track of their goals, or especially when clients are feeling again stuck, or unpleasant feelings are coming up again. You can keep reminding them of this. So it's a very helpful tool. Okay, so I think this is the last bit of the applications of ACT. And now ACT protocols generally follow two paths depending on the client's concern. So sometimes clients don't know what direction they want to go into. So that we start with the basics, then we start with goal setting values, and sometimes clients know what they want, but then there are obstacles that are coming in their way. Like they know that they want to perform better at work, but they are overthinking. So overthinking is an obstacle. So if there is situation A where the client doesn't know what do they want, where do they want to go, then we can do these pointers that are mentioned, which is we clarify values, we set goals, we include some problem solving skills. Skills training would basically include again maybe emotion regulation, maybe assertiveness wherever it is required, or any other kind of skill deficit that you feel is present in the client's life. Exposure would basically be for fear related or phobia related concerns. Now, what's getting in the client's way? So if the client is not able to pay attention or finding it difficult to pay attention, then we help, we focus on that by helping the client get in touch with the present moment. And if the client is if fusion is happening, if overthinking is happening, then we can introduce diffusion. And if again there are coping mechanisms that are constantly leading to avoidance of their feelings, which they need to come in face to face with, then we can introduce the concept of acceptance. And yeah, self-criticism, hatred, neglect can be targeted with compassion. Okay, so well, this is the last bit, act as a therapist. And well, this slide is about how ACT is relevant for us as therapists as well, and how we can use a lot of these concepts in our own sessions when we are feeling distressed. So definitely therapeutic relationship is central to most therapies, therapy techniques, and most therapies. But apart from that, being present in therapy is so important, because a lot of time we might get triggered by what the client is bringing into the sessions, or we might also feel incompetent with what the client is sharing with us. We might feel like a lot of times, I think, like in the beginning of my journey as a therapist, when after completing MPhil, the biggest challenge that probably I used to feel was that every time the client used to bring in their concerns, they would share that they are feeling stuck, they don't know what to do, and most of the individuals would ask you, what should I do, and that used to catch me off guard. So but that was because probably I was not in touch with my own emotions. I was probably not in touch with what is happening in the therapy session. What I was too focused on was that, okay, I have to, like, okay, the client is saying something, but I have to like constantly think of solutions. But you don't have to do that as a therapist. All that you need to do is be there for the client, be present. And in some situations when we are feeling stuck, we can remind ourselves, I found this very beautiful, that do I see this person as a rainbow, or do I see this person as a roadblock? Because I think at some point, when if an individual, if a therapist is experiencing fatigue, if they are stressed out, if there's a lot of caseload, if they're not getting any time for themselves, it can lead to them judging their clients and seeing their clients as roadblocks. That, okay, I don't want to take the session today, I really hope the client doesn't show up. So you are seeing the client as a roadblock then. So in that situation, it can be just very helpful to remind yourself that every client is different, just like a rainbow with there's so many colors, so every client is different. And if there is a certain resistance that's happening, it's only happening because of the client's context, because of who they are, right? um So yeah, when clients are stuck, we're not making any progress, I think it's very natural. We are humans, we can also start feeling frustrated, and we can start judging very quickly. So again, that's something that we need to be away from, or practice diffusion with. But I think one thing that came to my mind was this example of a client who was aggressive. So I was working with this company called Optum before I started practicing independently, where I was basically working with, you can say it was like a helpline where we were providing therapy sessions to anyone who was in need. So basically, these were employees and they had a contact number, a helpline number. So this individual called, and I was doing a night shift, so it was at night, and the individual called, and the individual was sounding very impatient, sounding very, frustrated. And I was following my protocols of the company Optum, which is to take the client details and, just take a little the basic intake questions. And the client was just feeling frustrated to answer all those questions. So the client was like constantly probably saying statements which were triggering me, that you're wasting my time, or what are you doing, can you just tell me what to do in this situation, was the tone of the client. And in that situation I was extremely triggered as a human, because there was a lot of pressure, there was this tone which was constantly threatening. And in that situation I had to remind myself that this is an individual, this is a person who is going through their difficulties. And rightly so, this client had a father who had dementia, and dealing with dementia is hard as a caregiver. So this client was basically a caregiver. He had been taking care of his father for a long time, and then there was a major situation that had happened which had deeply hurt the client. And then there was this client's helplessness, because the client cannot do anything because the father has a major illness because of which he cannot understand, and the client doesn't know where to take out all that frustration, that anger, that hurt. So there was just a lot of it in the therapy session, and it took me a while to understand that. But what helped me understand that was taking a step back from all that unpleasant emotions that I was feeling in the therapy session. So I had to just like remind myself that just focus on what he's saying, or maybe like just like simple statements like, don't lose your calm, or be calm, you are a therapist here, you have to be present. So a lot of these reminders helped me in that session. um so yeah, I think ACT is a very helpful, as a therapy, it's very helpful for us as therapists. And I think one more point that I'm missing here is how it really helps you be authentic. So I feel like my approach is very humanistic and existential, very focused on what is the meaning of an individual suffering, their context, and how can they be true to themselves. And it was very surprising for me that I found that in a behavior therapy model. I think ACT really helps the individuals, the clients, and also helps you as a therapist to be your authentic, unique self because of the focus on values. So, yep, I think this is it. With this, we come towards the end of our presentation, our session. And yeah, the house is open to any questions that you may have.